Hey, good
Cold
morning,
open, Brad.
everyone. It's Brad and it's Jeff and our guest Chris Jaquis from Antidote. So thanks for joining early. We've got about 30 people registered, and I only see about 5 names. So let's just hang on a few minutes because Chris has got a really good presentation to share. So hold tight. And Jeff, can you see on your screen? I don't
Yeah,
know
I can
next to everybody's
pause the
name why
recording.
there that yield signs are there. Do you know what those are? See the yellow boxes?
Yellow boxes. I'm gonna pause the
The
recording.
yellow triangle. Beglin from Cincinnati, me from Cleveland, and we've got our friend Chris Jaquis, who is, I'm going to say he's like executive vice president and national sales manager and lead customer service rep, broker support advisor, everything. He's a one-man band doing it all. He's now calling in from Arizona, which he just arrived to last night. So we're happy to have him at like 5:30 this morning in Arizona, right? Is it 2 hours in the summer or three?
6:30.
Anyway,
6:30.
it's three. 6:30. Okay, so in the winter it's 2 hours behind. Anyway, um, so we're really happy to present this to you because last pre OEP, Antidote was very new and we were late in getting it rolled out. And so we have about 40 brokers licensed or appointed with Antidote. And we'd certainly like to get more. We've added a lot more recently. So I just wanted to make sure that Chris is getting you up to speed with their um, off exchange product for 2024 and every finger and toe cross that I have, and Chris's as well, that they'll get CMS approval to be on exchange for 2025. So enough with me blathering on. Jeff, do you want to advance the screen
All right.
since you're running that? And I
I'm gonna
think it
make
actually,
him. I'm gonna
yeah,
make him the presenter.
oh, that was the last slide. I'm
That
sorry.
was the last slide. So let's make him the presenter. Get rid of that screen. So
Wow, I'm seeing a
all right.
lot of big names on this call. Nice. Hi,
Chris knows.
everyone. Nice to see all your names.
Chris is going on and presenting a screen. System's running a little slow, but it should pop up.
Just trying to get back to where we were.
Okay.
Is it possible to go back to hell once you're already there or no?
Took me out of full screen when Jeff shared, so I can't get to that button. Let's see if I can get to it. There we go. Are you guys
There we
seeing
go.
it?
Yep. We're good. We're good. We're good.
Rock it on.
Awesome.
Yep.
Well, good morning, everybody. I cannot see you guys at all or see the chat. So if you have any questions or you can't hear me right now, please chat or ping whoever you communicate with Brad and Jeff because I can see them. So I want to
Yep.
say good morning and thank you, Brad and Jeff, for having us back in again to do a presentation. To follow up and just to in suit, just going to do a high level where we are this year with 24, review the plans, and then we'll start give you some tidbits, some nuggets about 25, some exciting things happening for next year. So our mission, I think, for those of you who've spent any time with us, we really believe, our leadership believes that everybody should have the ability to attain affordable quality healthcare. So we believe we're transforming healthcare by bringing virtual first care and advanced technologies to the insurance industry. We're very excited, and everyone's going to say everyone's doing that. I think we do things a little bit differently with our virtual care model, and we'll get through some of that and take some questions at the end. So those of you who don't know, our origin, our co-founders, our experience, they came from Israel. They ran insurance companies there. They actually came to the United States with the intent to create an insurance company when they came, you can't become a virtual first provider without creating a virtual first practice. So we started as a telehealth provider. So we have a telehealth arm. Those of you who've done your own research, I think, have said things to me like, you're a telehealth company, you're not an insurance company. We have both sides. So that's one of the things that's a little confusing. So just remember that there is Antidote Health, the medical practice, which is a telehealth organization, and there is Antidote Health of Ohio, health insurance, and now of Arizona, which we'll talk about later. Giannis Jaquis, if you don't know him, the Greek freak, he plays for the Milwaukee Bucks. He's one of our major investors. If you have not seen Giannis's story, I would recommend Googling it, go on YouTube, check our website out, you can find it. Giannis tells a great story of traveling and growing up throughout most of Europe and not having the ability, from Africa to Greece to Europe, and not having the access to care, not having a father, not having insurance available. So it's nice to have a partner like him who's behind us, and we'll hopefully get him into the market sometime soon. They're out of the playoffs now, so maybe we can get him over to see us. Why are we different? Our virtual care is always available. Members don't need to see a different doctor every time they come see us. Each member is assigned a virtual primary care physician. They do get a brick and mortar, which we'll talk about, but they have their own primary care physician. So when they call into virtual care, if they want, they can see their own physician. They don't have to, depending on what the kind of care they want. So they can schedule an appointment. If I want to see Dr. Brad and I want to schedule with Brad, I can coordinate an appointment with Brad. If I want to see first available, I can see first available physician. The big thing is our doctors are primary care focused. So we're not coming at this from a lens of, most of your telehealth providers are urgent care focused. And I will tell you a lot of our visits are urgent care focused, but our doctors are trained and are primary care physicians. So that's the one big thing that makes us different when you talk about our virtual care and our virtual first model. Obviously, advantage for our members, accessibility. We believe we're affordable, and we're trying to increase convenience of care, access to care. One of the things we find is that members cannot get the care. So having 24/7 access to your physician means you can get a doctor's appointment immediately. So our plan options for 24, this is kind of high level, but again, we had our 24/7, our family first, our 24/7 complete, and our family first complete. So that if you notice, the 24/7 and 24/7 complete are our naming conventions. These kind of give you the high level view of what's included. You get your unlimited virtual visits, primary, urgent care, mental health. You get your assignment to your virtual PCP. There's some cashback options, and there's options for dental. In the complete plan, you actually get the the top RX, which includes the select RX. And in family first, you get $0 benefits for pre and postnatal visits and 24/7 pediatric care. These are our plans and naming conventions. Again, this is different numbers, different ways to get them. This slide is really provided to you when we share the deck with you. You can click on these links and they take you right to the SBC. This is the plan. Some of you have seen a version of this. We tried to clean it up to make it a little more easy to explain. What you'll see here is, and I like to work right to left. It just seems to be easier. But here is, you're getting your naming conventions, your 24/7, your 24/7 complete, and then you have your family first and your family first complete. If we work
That was
right
left to right,
left,
by the way. That was left to right, by the way.
it was, but we're going to go right to left now.
Oh, okay. There you go.
If you see in the right-hand column, you're going to see a number printed: $75, $40, $25. If a member wants to go directly to the doctor, they can. That's their copay. However, we've incentivized virtual care, and for them to use the virtual care path, we call it the happy path, by being $0. If they go to the virtual visit, it's free. If they get referred, they get a reduced copay and deductible, which is recognized there in the middle column. So that's how that works. You'll see other things identified depending on plan level, how they're covered, what's covered. And then you'll see here down below, this really speaks to the level of the medications and the richness of the the pharmacy plan, the formulary. We are not able to get rid of copays and deductibles. We'd love to. That's our goal. However, people are going to end up having severe issues. They are going to need to have copays and deductibles. It's a reality. The goal is to really, if you think about our plans, is to eliminate the ordinary cost of care for folks. Going to the doctor because you have a cold shouldn't cost you a lot of money and shouldn't break the bank. Going to the doctor because you have an ear infection. Going to the doctor because you have diabetes and you need to get your medication changed or reviewed. Mental health medications, cardiac medication shouldn't break the bank. We believe that care, quality care, should be limited to no cost. Here you'll see the formularies.
Hey,
This is just
Chris,
a
can you do
high-level
something
view.
real quick? Go back
We
one
can.
slide. I just wanted to point out, since we have some very newbies. So, gang, look at where was it? The 24/7, 24/7 complete, and then the family first and family first complete. And if you look at the one line, the third from the bottom, Chris, if you were going to get to that, sorry for stepping on your toes, but I wanted to point out the main difference of the plans, and it was really about this first pre and postnatal visit on the family first plans being at zero copay. So the when I first saw these plans, I saw it as a plan, at least initially, that would be good for young families because of those low copays, right? It's virtual. You can go to CVS Minute Clinic and get virtual, but on the back end, yes, there's a health plan tied to that, but not directly. But there's a health plan tied to it. And the other thing too, back to the drug list, as Chris said a slide or two ago, those formularies are available there, but check out how when you get to the 24/7 complete and the family first complete, how much more robust the formulary gets. And even it says zero select and zero top. I'm guessing there's some top tier available
Correct.
drugs in those, right? So,
Yes.
I've seen this several times, and a couple of you I know have been to our meetings and have. But I just wanted to point it out. And Chris, I love the new format of the sheet. It's way easier to read for middle-aged eyes.
Yeah, it is. I agree. Ann wasn't able to join us. Ann's our new CMO, and we're going to
Okay.
talk about a lot of things coming in 25. But this is
Okay.
one of her
Great.
updates for us.
Great. Great. Great.
Um,
Great.
thank you, Brad.
Yep.
Thank you for pointing
Yep.
that out.
Yep.
Here you'll see some of the medications. Again, this is just the advertising piece. We pulled out some of the most commonly used medications to give you an idea of what zero medications can be. We really do believe that everyday cost of care can be limited to $0. It really can be, and it should be. And people shouldn't be worrying about, I've got a $300, $400 copay to get my medications. That's just ridiculous. I actually use the story. Brad knows this. My daughter lives in Ohio, has a plan. I won't say who it is. To go to see her physician to get her medication refilled, it costs her $265 out of her pocket until she gets to like her 12th visit, because then she'll have maxed out the copay. It's ridiculous. That shouldn't cost that. Truly designed for chronic care, help those with diabetes. Obviously, we hit on this. You'll see this. And so I think we're going to talk a little bit about how it works. And I'll move forward through this for you a little bit. But you can add adult dental, which is very important, 100% preventative care, 50% co-insurance. We partner with Paramount. Paramount is our partner, if you know them, in Ohio. Good plan. So this is how the plan can be used. And I'm going to take a little bit of time. We've changed this a little bit too, Brad. So for everybody, didn't mean to do that. My apologies. So one, you'll see member logs in. They schedule a visit. They start typically within 15 to 30 minutes. Our longest wait time has been 6 hours. That was a rash of calls over a period of time, just being very transparent. But our average wait time is 22 minutes right now. It's amazing. They see their Antidote virtual PCP. There's no cost. They order their medication, $0. They go pick it up. That's like a perfect scenario. Well, let's talk about what's going on in the background right there. So as Antidote is your primary care physician, we're taking that information, adding into our EHR, using AI, welcome to the AI world, and creating a care path for that member so we know how to help them. They've been in before, this is going on, what's happening in their path. We are a traditional HMO. So in many ways, that's the plan. 20 years ago, 30 years ago, when I was a kid, HMOs came out. Nobody wanted to go to an HMO. People are actually okay with a little bit more direction. I think we have found in the healthcare field that you can give direction and also still give choices, which make care better for folks. But let's look at number two. Number two is a nice path. Member logs into the portal. They see the virtual PCP. They get referred to a dermatologist. You get a prescription, and it's $40 copay because they were referred to a specialist. They get their medication at $0. Versus what we like to show number three is what's today bricks and mortar real life scenario. Call your PCP, 1 to 2 days to get a visit, get a referral to a dermatologist, which you're going to pay a higher copay. Probably not going to see the dermatologist for a week to 10 days, and then you have another copay there, and then you pick up your prescription. So you can see the happy path creates that a saving of time and money, as well as providing a care path that's going to over time really help the members' long-term care.
Yeah, in that example, $185. I'd be willing to go through those steps to save $185. That would buy me a massage.
So we like to say it's healthcare on a member's term. So your virtual first care, $0 copay day or night. In-person care, 25 to 75 depending on your plan. And then when you get your blended care, when you see your Antidote virtual PCP and you get referred to your in-person PCP, it's $0. So remember that if you start your care path and you get referred to your PCP, it's a $0 PCP visit. So we think that's amazing. The app. And this is one of the things I think we talked about last year for those of you who came to a training. We have an app. You go to the app, you can see here the picture is very easy. This is actually the telehealth app. The HMO app is being improved, but it looks very similar to this. You'll see tiles at the top, your member number, your claims, your prescriptions, schedule an appointment, easy to use. And that's actually how you schedule your appointment. Where we are presently are the 22 counties highlighted in light blue. So the Cleveland market, down the Columbus market, and that I-70 corridor. And then we have Butler and Hamilton over in the Cincinnati market. That's where we are today in 2024 off exchange. Here are some of our network providers. I think some of you folks have seen this. I know that this has been a big ask for folks. We continue to work on the network, but this is who we have today. I think the other big ask we'll talk about coming up. But obviously we talk about partnering. So we talk about our broker support. As Brad says, I'm available. Our team answers the phone 24/7. We say 7 to midnight, but the calls transfer over into our customer service line for members after midnight. So if you happen to be signing up a member at 2 a.m., you're going to get somebody on the phone to take your call. It's going to get referred to me in the morning probably. The broker portal, it's a little clunky to get into, but it's pretty easy to use. We are developing co-branded marketing materials. Our plans are ICHRA eligible, and we think we have some competitive bonus. And
Chris, I lost you if you can hear me. Chris, if you can hear me, you're frozen. Guys, gang,
can you
give
hear
me
me
a
now?
second. Yeah, I can hear you now. I can hear you now. Good.
So where'd you lose me?
Right when you were talking about the broker portal and co-branded marketing, and if you
Yeah, we're
want,
working on rolling out new code. We're rolling that out for you, as well as ICHRA eligible plans. Our plans are eligible for ICHRA now off exchange. Um, we have bonuses we're going to talk about. Obviously, if you're not appointed with us, we'd love to have you be appointed with us. My next
yeah. And
slide.
Chris, before you
Here
go
is the
further,
commissions presently.
yeah, I'm sorry, but go back 2 slides. Um, the network slide. And gang, if I just wanted to point it out to you really quick, upper left-hand corner. This is the reason why I like Antidote Health, because you now have an alternative. Chris wouldn't do it, but I'll do it, to Oscar. We've heard many complaints We had a good presentation at our expo about a month ago, and he was surprised to hear that they were getting bad press. So I was excited when I met Chris to be able to share that there's an alternative or another provider that has access to the Cleveland Clinic, as well as the other great hospitals, Ohio State University, which everybody seems to want, Nationwide Children's, Mount Carmel, all top-notch, hospital systems. And hopefully, maybe Chris will share in a little bit if they're going to expand, which would be new to me. But I just wanted to point that out, and that's the whole reason why I personally have made a big deal. Jeff is not as excited um, because Cincinnati has Mercy Health, which here in Northeast Ohio, at least in the Cleveland, Lorain County area, is not like the number one hospital in the world, not like some of the others you see. But Chris has heard that about 18 times from me. So I think he knows that he needs to work on Cincinnati for my friend Jeff. All right, carry on. 2 slides in advance.
So since we came back to this, I will add bottom right-hand corner. For those of you who don't know, Quality Care Partners is our network partner. We actually partner with them. They actually manage They're Ohio-based. They're down in Zanesville. They know the market. We're excited to have them as our clinical partner and network partner.
And they own the Genesis hospital system also in Zanesville, or it's the same organization, correct?
Not anymore, but correct. It was formed
Oh,
out of that.
really?
That's correct.
Okay,
Yep.
got it. Okay, sorry. Carry on. There
So
we
we
go.
were at commission schedule. So presently we're
Yeah,
paying a $20 commission per member per month. The key is per member, not per policy or plan, per member. And we have a spring bonus going on right now, which is $200 per member, not per policy, per member. And we pay that out for the first 5 members on a policy. So I just want to put that out there for everybody. Now, I will talk before going ahead, I'll talk about the hurdles we have. We're off exchange. We're not presently on Health Sherpa. So you have to go through our broker portal.
Chris, you locked up again. If you could hide your or turn off your camera, that might help with bandwidth. Dang, sorry about this. Chris, if you can hear me. Chris? Okay, yeah, your camera's turned off. Good deal. See if you can carry on. And Chris, maybe the better thing to do is call in for your audio. I will text you that number. Give me a second. It's 914-614-3221, if you heard me. I'm just sending it via text, Chris. Brokers, just hang on the line while we figure out this technical issue. It's got to be something with those lizards or scorpions in Arizona. All right. He completely dumped off. So, and I don't have his presentation.
This is Ann Letera. I'm Antidote CMO. I'm on the line, so if Chris doesn't pop back in a minute, I have the presentation and
okay.
I can
Perfect.
pick
Thanks,
things.
Amber. Yeah. If you want to, just do it now until he comes on, and then I'll make you presenter. And hang on a sec.
I can do it.
I got it.
Okay.
Okay. and your presenter. So go ahead and share the slide deck
All right,
because it
I
sometimes
will.
takes a while to call in. So even if he calls in,
Okay.
we'll use your deck and he could talk to it.
Yeah, let me. It's stuck in SharePoint right now, so I'm just trying to make sure that I can download this copy to actually present it properly. So just give me a moment here.
Yeah, I was wondering if he sent it to me. Do, 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 do.
You there?
Hey,
Yes, we're here.
Sorry about that, everybody. Microsoft decided to block the presentation.
Wow.
that Bill Gates, I tell you what, he's probably got his
He's
own insurance
retired.
company. Yeah.
Yes, he does. All right, Chris, Ann just jumped on and she was gonna share her screen. She was going out to find the presentation. So
I got it.
you got it?
I think
Okay.
you're good. Okay.
Just allow me to share again.
Yeah, I'm gonna do that right now. All right, you're good.
I'm waiting for it to show up. There it is.
Yeah, we've just noticed that sometimes when the cameras are on when you're presenting,
Yep.
it makes things get a little wonky.
I'm just waiting for the tab to allow me to takes its time to show up so I can
Yeah.
join.
And yeah, while you're doing that, I'm gonna say to Stephanie, you and I need to talk, Stephanie, because we're only a town apart. 'Cause we've been supposed to get together, I don't know, since last fall. But yeah, so let's talk to each other soon.
There we
And there's
go.
only one Stephanie on the call, so
Got it? Are we up? Are
yep,
we live again?
yep, we're good. Go for it.
So
This is
let's talk about next
2025
year.
goals. Okay.
Let's talk about next year. So one of our exciting things is, and we'll talk about it, is Ann. And Ann has joined our company. And Ann, when you get a moment, say hello. But she's our chief marketing officer. So we'll talk about a few things that are going to be different for next year. But here are our goals. We are targeting 30,000 members. We truly want to disrupt the market in Ohio. We intend to keep providing quality customer service. I hope we're doing that for you guys now. But those are our goals for 25. What's coming? We did file an application to be on exchange. Our expansion in Ohio is hopefully going to be more than 50 counties. We did file for more than 50. Obviously, we have to wait for approval. We continue to grow our list of hospitals on our networks. Adena is the most recent system to join. We have gone to $0 in-person PCP visits as well as virtual visits. So virtual visits and in-person bricks and mortar PCP visits are $0. We have eliminated prior authorizations and referrals. Only a few things require them. They're very complex procedures. I think you would understand. We're not going to let somebody cut somebody open without having a prior auth. But all those regular day-to-day prior auth, I need to go to the audiologist, approved. You need to go get a gastro done, see a gastroenterologist, approved. So we've made that very simple, just like a lot of other plans out there now. And we're adding $0 lab benefits in Ohio. So it's going to be very exciting. Some big changes, first year knowledge and adding some more folks within our team. Listening to what you're saying to us, we've really made some changes. We're excited. Here's the footprint for next year. You'll see what we've expanded. We're hoping to expand to. You'll see 53 counties, identified. We're waiting on final approval, but we submitted our initial application and we submit our final application next Tuesday. And this is what we're going for. So we're very excited. We find our pricing to be extremely competitive. For those of you who don't know, we're also in Arizona, in Maricopa, Pinal, and Pima. We'll be offering small group as well as individual and family on and off exchange. So we don't do small group in Ohio. ICRA seems to have more traction here. So in Ohio, but those of you who are licensed in Arizona, just want to give you a heads up about what's going on in Arizona. What's new for you? What's new for the brokers? So a new broker portal. needs to be easier to access, easier to get into. We're changing it. We heard you. We're hoping to roll it out late July. Commissions and bonuses. We're expecting more rewards your way. We're working on that. Here's the Ann piece. She's not here, but we plan to have a lot more marketing materials available for you. She's going to be creating some different ways for us to be able to share marketing materials with you. So we're very excited for that. So that's part of the 25, Plan Year 25 offering. Here's our new dashboard for brokers. So just a quick glimpse at it. Very clean, very easy to read. One of the things agency-wise, agencies now will have access to see what their agency is doing. Before we didn't do that. Now we can, or we should be able to. Applications, enrollments, easy to track, easy to follow. Just making it a little bit simple, just a little bit more simple and easy for the brokers to use and access. So with that, that's the presentation. I'm going to open it to the floor. If anybody's going to stop sharing, and I can turn my camera on.
Chris, that was awesome. Thank you. I'm really excited to see some of those new items come to fruition, and the expansion. And for us, for those of you brokers on the line, tell all your other broker friends that they can get contracted with Cornerstone Broker Services to get Antidote added to their portfolios like you. So I just think with that expansion and some additional hospital systems and primary care groups will help make we'll get them close to that 30,000 just from Cornerstone. But we
We're
need
excited. Sorry,
Chris,
Brett.
you ready for
I
some
think
questions?
we're ready. If you got questions, just bring them.
Yes,
Ann
we
and I are
do.
here.
We got plenty of questions. Yeah, I've got questions too. So, first one is, how is coverage done out of state origin? So
So
you're in
interesting
Kentucky,
enough,
you're in Florida. Yeah.
so we are on exchange, or we are an HMO. So there is no out-of-network coverage. So if a provider or a network member is in our network, in Antidote Health Plan of Ohio's network, and a member happens to be there, they can see them, and that would be a rarity. Cleveland Clinic's got a facility in Atlanta. You could do that. Now, our telehealth coverage, if you're in the 22 states that we offer telehealth coverage, you can see your virtual health provider for free. That coverage happens. But there is no out-of-network coverage for Antidote Health Plan at this point.
Is your telehealth in Florida? In Florida.
Excuse me?
no.
Is your telehealth available in the state of Florida?
Yes.
Great. I
That's
mean,
one of the 22
invariably
states.
the question is, how are you covered in Florida? So that's a fantastic option. I mean,
Yeah, they can see telehealth, but they're not going to go
yeah,
to a doctor there,
yeah,
maybe except if Chris,
yeah.
would they have to get authorization to go to the Cleveland Clinic locations in Florida if they get referred?
They won't appear in our directory, but if a member happened to be in Florida and they wanted to go to Cleveland Clinic, they're in network.
Okay. But it would probably help
Now,
to get the
I think
referral, right?
the other thing to point out about the network is this: a lot of the other individual and family plans within the state of Ohio limit their coverage or their care to their service area. We do not. The service area is only the limitation to sell the plan. If a member lives in Cleveland and happens to be in Cincinnati and has health issues, they can go to a doctor in Cincinnati who's in the network. Does that make sense to everybody? I think the one we heard, the example we were hearing this fall was, my kids are going to go to Ohio State. Will they be able to go to Ohio State because they won't be in the Cleveland market? I'm like, yeah, they're Ohio State physicians are in the network. They can. Our network is not limited by service area. Our network is limited by who is contracted with us.
Okay, fantastic. I got some more questions for you. Now, are emergencies covered as in network? Let's say out of state.
Yep.
Of course. They have to be. That's a requirement, right?
Yeah.
And urgent care as well. Yeah, urgent and emergency are always covered for a member,
Okay.
both in ACA as well as Medicare.
Next
That's the
question.
minimum requirement.
Next question. Can you
I
provide a list of
lost
the states?
for a second. I apologize.
It's breaking up a little bit. So, Chris, can you provide a list of states? Or Anna? Or Ann, can you provide a list of the states?
We're the states that we have our telehealth service in, or the states where our insurance plans are. We're in Ohio for 2024, and for 2025 we'll be in Ohio and Arizona, and it's a list of about 20 or 22
Right.
states, I think, for telehealth.
That's what we're asking, telehealth, virtual health.
Got it. Okay.
Yeah, and I
And
want to answer Gary's about what's the definition of emergency. Gary, I think you've been in the business long enough. You should know that it's life or limb. You're not going to go there with a bloody nose, right? If your arm's broken, you have a puncture wound with a knife, or you're impaled, then you can go to the emergency room. So, yeah, that should explain that. Go ahead, Jeff. What other questions are there?
um, so I guess we're just looking for. Oh, there they are. She put it in the chat, and if you guys take a look. Hopefully, everybody got that in the
It's
chat.
actually no, that's in questions, not in chat. I think, right?
Oh, it's in chat. Let me throw it
Is
in
it
the.
okay?
Um,
Well, they can see in chat, they can't see in questions. So, providers are available in Arizona, California, Colorado, Washington D.C., Florida, Georgia, Illinois,
And I'm back.
Maryland, Massachusetts, Michigan, Missouri, New Jersey, New York, North Carolina, Ohio, obviously, because we're special, Brittany, PA, Texas, Utah, Virginia, Washington, and the Cheesehead State.
we've got this out to you in the questions, so I
Yeah,
just sent it to you.
cool.
Fantastic. So more questions, and I want to dive into this a little bit. Technology. So, Chris, is it possible, or Ann, is it possible for you to pull up the enrollment screen? Is that doable? And on your screen, so I could share it with the team?
I can show you the sample that we shared during the slide. I don't have the ability to put the enrollment screen today because of the
Okay.
network issues I'm having. It's going to work. I can tell you that.
All right. So I guess I'm not able to make you the presenter. That's crazy. Can Ann pull that up on hers?
She probably doesn't have access to that anymore. We're
Oh,
changing the
okay.
broker portal.
Oh,
It's under
yeah. Well,
construction.
you can share that with me, a screenshot of that, and I can share it with them after the presentation.
Yeah. And we're going to share that presentation, and the screenshot of the new enrollment screen will be on there for you.
Okay. And what's the ETA
It's
on
in there
the
today.
new broker enrollment platform?
End of July.
End of July.
And we
Okay.
do plan to be on Health Sherpa if we are on exchange.
Fantastic. Okay. That's great. That's great. And I do want to emphasize, just from my point of view, this will be a terrific option for those people doing ICRAs. We're seeing the ICRA platform, the ICRA solution just explode, meteoric increase in interest in ICRAs this year. And I think with this broad breadth of networks that you have in Ohio, the clinic, Mercy Health, Genesis, this is going to be a great option. As you're well aware, if you're using an ICRA, you're not going to get a subsidy, so just sell the darn thing off exchange. So I think this is a great option as we explore ICRAs.
Agreed. And Jeff, I mean, it's the numbers usually are ICRA is exploding nationally, but we have seen just with us here at Cornerstone
Mm-hmm.
how much interest we got. I think the busiest person besides me and Jeff was Lael Reitler, who is our ICRA enrollment specialist. Everybody was going up to her, had some groups that could no longer afford the 20+% increases year over year. So they're legitimately looking at an alternative solution to present to clients, and we can help with that. So we have the access, and if you're not familiar, um, how everybody gets their cut, you can charge. So not only do you get your commission, your monthly commission per member per month, but you can get an advisory fee, right? That's yours. Um, our platforms, NextBend, Benefit Bay, they get a $10 to $15 cut. And if we're helping you, we get a $10. So you're maybe adding $45 PE, per employee per month, um, on the addition cost that the employer is going to be paying for that. So that's how you get paid. So you kind of get you get the commission, the straight up commission, and you get a little bonus on it. And that fee structure is determined by you and us and them. But you don't want to over gouge on that advisory fee because somebody else will beat you, and you never want to get beaten, right? Come out with a fair price and you'll get the business. What else, Jeff? Is there any other questions?
I think we pretty much covered everything. This is your last chance to throw in a question. I'm really delighted that Ann and Chris could join us today.
Yeah.
Kind of wrap things up.
You're welcome, Brittany.
And for those folks out there, Brad, available. I think some of those who tried to reach out to me directly, you're more than welcome. Schedule time. I'm in Arizona today, and I apologize. Between Microsoft and Wi-Fi services. But I'm available. Call. I'm in Ohio lunch. Love to sit down, have some coffee, answer any questions you have. Any problems? I did an enrollment with an agent last week. Literally, step by step, welcome to the portal. So let me know.
Yeah, I am going to put, gang, Chris's email in the chat. He's probably better to email than call because he's traveling so much. Poor guy is on duty, it seems like 18 hours a day. He calls me on Fridays at like 7 o'clock, and I'm like, seriously? And he's like, I'm still driving home to Lancaster, PA. So he's a hard worker. So yeah, I just put in, oops, that only went to Ann. That's strange. Oh, now I know.
And I'll forward this presentation. We'll forward this presentation to you, Brad and Jeff, so you can send it out if you'd like, or have it on
do that as soon as possible, because we also send it out with a recording link as well. So good. I think we're good. Everybody, just take a look at Chris's email that I just put into the chat message, and you'll be able to grab it and get help. There's a really great broker support person who I talked to about 2 weeks ago, Rose. She is out of Florida, as a matter of fact, and she's awesome. And I think she answered my call at a ridiculously early hour of the morning because she loves her job, which is just amazing, right? So, all right, that's all I have. Props to the Antidote Health people. And I'm waiting for my signed basketball from Giannis, Chris.
Me
Any
too.
day now.
Too.
You too?
Thank you, everybody.
Come on.
Thank you, everyone, for attending. Like I said, feel free to reach out. Honestly, want to be available, want to support you, want to help people get care. Let us know.
Yeah.
Fantastic.
And if you're not already contracted or appointed with Antidote Health, let Jeff or I know, and we will get that ball rolling for you, because I think now is the time to do it. You're all going to get pretty busy come June 20th with your AHIP contracting and everything you got to do to let everybody know about all the big changes for Medicare. And then, oh, by the way, then you have to do your FFM certification and deal with all that stuff too. So it's going to be a busy, busy, busy summer. So those of you planning those September vacations, you might want to reconsider this year. So anyway, thank you, everyone.
If you are contracted with us, Jeff
Go
and
ahead,
Brad, if I
Chris.
can, one more.
Yeah.
If you are contracted with us and you haven't accessed the portal and you have a member that you want to write and need help getting in, reach out to us. We can definitely help you get in. We understand it's clunky. We understand that some folks' invitation to the portal got lost in their spam. So please let us know. But over the next month or two, if you've got something you want to get done, we're here to help you.
Is that another change you're going to make, Chris? Getting rid of Miramar and going with somebody a little bit more user friendly?
I got a couple year commitment, but they're going to make it easier for us.
Okay. Okay. Good. Because that's been my problem since like last September.
Fantastic. I think that's
Yeah.
it.
All right. That is it. Everybody have a great rest of your week. Jeff,
Have a great
say
day.
goodbye. Yeah, you got it. Take care. Bye, Chris. Safe travels. Don't get
Thanks,
bitten by a
everyone.
scorpion.
Have a
You
great
got
day.
it. See you. You too. Thanks. Bye.